It's only natural for us to want to know, is it more contagious? Is it more deadly? Will the vaccine be as effective? But those questions are really hard to answer, and they're answered through really rigorous research. And right now we're at step one. Step one is just identifying the variant. This particular variant does have a mutation that is related to what we call the spike protein, which is something that the virus uses to attach and infect cells. And the spike protein is also something that current vaccines and antibody drugs target. So there is always a concern when we see a spike protein mutation that could in some way help the virus escape from drugs or our immune system or vaccines. Viruses develop mutations when they infect new cells and when they replicate. So if we want to limit the opportunity for them to continue mutating and spreading, we just have to kind of stick with the same public health measures we've been doing. Anything that we can think of that we know helps reduce the spread of coronavirus, regardless of what the variant it might be, will help us avoid developing more of them. I think we've been in some ways a little spoiled with the COVID-19 vaccines because the efficacy rate was so high right from the beginning. These are very demonstrably good vaccines for COVID-19. And we don't have any evidence that they're anything but effective, even against the variants. It's understandable that we woke up today in a panic because the UK variant started like this, others have started like this, but we really won't know the answer to these questions for a while. And people, if they're concerned about variants, really what they should do is just continue to do what they've been doing this whole time, if they want to help curb the spread and reduce